For the ones who get it done, the most important part is the one you need now. And the best partner is the one who can deliver. That's why millions of maintenance and repair pros trust Grainger, because we have professional-grade supplies for every industry, even hard-to-find products. And we have same-day pickup and next-day delivery on most orders. But most importantly, we have an unwavering commitment to help keep you up and running. Call, click Grainger.com, or just stop by. Grainger, for the ones who get it done.
It is Ryan here, and I have a question for you. What do you do when you win? Like, are you a fist pumper, a woohooer, a hand clapper, a high fiver? I kind of like the high five, but if you want to hone in on those winning moves, check out Chumba Casino. At ChumbaCasino.com, choose from hundreds of social casino-style games for your chance to redeem serious cash prizes. There are new game releases weekly, plus free daily bonuses, so don't wait. Start having the most fun ever at ChumbaCasino.com.
No purchase necessary. VGW Group. Void where prohibited by law. See terms and conditions. 18+.
Hey all, welcome back to the Real Life Pharmacology Podcast. I'm your host, pharmacist Eric Christensen, and I thank you so much for listening to this episode today. The drug I'm going to cover today is Paroxetine. Brand name of this medication is Paxil, and this is probably a known agent to you in some capacity. It is an SSRI, so similar class to sertraline, citalopram, and all the other SSRIs. So ultimately, it's going to block that reuptake of serotonin in the neuronal synapse in the brain, which in the end will increase serotonin activity and help manage conditions such as depression, anxiety, OCD, PTSD, and rarely one other kind of unique indication for paroxetine, or that I've seen it used in clinical practice, is hot flashes as well. So that's kind of a unique one there. Adverse effects, definitely with SSRIs, there are some generalized class effects. Sexual dysfunction, of course, can be problematic. Any type of CNS changes can happen, confusion, sedation, dizziness, for example. With paroxetine, it's a little bit special as far as adverse effect profile goes. And because of that, it's actually on the Beers list, which is a list of medications inappropriate or potentially inappropriate in our geriatric patient population. So it is on the Beers list due to its risk for some mild to moderate anticholinergic activity, as well as sedation and low blood pressure, which could obviously increase the risk for falls. So that is definitely one thing to remember, and that's one of the a couple of different reasons why you really don't see paroxetine used as much in clinical practice compared to sertraline or potentially escitalopram. So definitely one important reason is to remember that Beers list criteria. Another one to remember with paroxetine that might limit the use a little bit is paroxetine should be avoided in pregnancy because there is some risk to the baby. So that's a downside as well as far as paroxetine goes. So many times you often won't see it started in females of childbearing age. Again, we'll look potentially towards other agents that may not have as many risks in pregnancy. Now, again, this needs to be taken, into clinical consideration with the patient you're working with, but certainly we need to weigh some of the risks to the fetus that studies have indicated with any potential benefit of the medication. Other, adverse effects or quirks with paroxetine, it tends to maybe be more so on the weight gain side than some of the other agents. That sedation side of things might be a little bit more common with paroxetine compared to other agents. Some of the anticholinergic effects, obviously dry mouth, things like that, certainly can happen. All SSRIs can cause SIADH, so low sodium potentially, so that's something to look out for as well with the adverse effect profile. All right, so let's shift gears a little bit because there's a couple of points that I wanted to make. So one is true of all SSRIs and kind of their pharmacokinetics is they take a while to begin showing benefits. So absolutely critical that you educate patients that this medication is going to take some time to begin helping in depression or anxiety or whatever retreating. So very, very important to remember that fact. One other fact with paroxetine, a little bit more specifically compared to other SSRIs, is paroxetine is definitely on the shorter end of the half-life scale. So it's got a shorter half-life, which means if we discontinue this medication abruptly, we're probably more likely to run into withdrawal-type symptoms from an SSRI. Okay? So half-life is in the ballpark of 20 hours with this agent. So again, that's kind of on the shorter end of SSRIs. Fluoxetine tends to be on the high end, where tapering off that medication or tapering off fluoxetine, if we want it to be discontinued, may be a little bit easier with a drug like fluoxetine, comparing it to paroxetine, which we're talking about today. So very, very important to consider that. There isn't a ton of clinical evidence or strong clinical evidence on exactly how to taper an antidepressant. I would say, in general, I look at a patient if they're on higher doses and they've been on it for longer periods of time, we're probably going to extend that taper period longer, or probably need to extend that taper period longer than we initially would think about. And for some patients, that can be up to months potentially. So definitely think about that when we've got patients on higher dose. Also important to remind patients with something like paroxetine, if they miss a few doses, they might begin to feel really, really bad, depending upon how many days they miss and that type of thing. And that can kind of be that SSRI with withdrawal syndrome, which they can experience anxiety and stomach upset and, things like that. That can be really, really disturbing and uncomfortable for the patient for sure. All right, so let's take a quick break from our sponsor and we will wrap up with drug interactions. If you're in the market for pharmacist board certification study material like BCPS, ambulatory care, MTM, or geriatrics exam, go check out meded101.com/store. We've also got links for pharmacy students to NAPLEX content, books for any healthcare professional. Recently put out a drug-drug interaction book in primary care and some of the clinical management thought process. Also drug-food interactions as well. So go check out all those resources, meded101.com/store. Support our sponsor and help keep this podcast free for all to benefit from. All right, so drug interactions. This definitely is important with paroxetine. So I mentioned, the pregnancy risk. I mentioned potential for anticholinergic effects, Beers criteria. So those are two big reasons why paroxetine is probably not the first SSRI you're going to choose. And one other one is drug interactions. And you've got to remember CYP2D6 with paroxetine. So some classic examples, classic drugs that can be affected by paroxetine. So atomoxetine, aripiprazole, an antipsychotic, metoclopramide, which I believe I have done in a previous podcast there. So these drugs, because paroxetine inhibits CYP2D6, we can end up having higher drug concentrations and potentially more effects and or adverse effects from these other medications like the atomoxetine, the aripiprazole, and the metoclopramide that I mentioned. And there's numerous other agents that are broken down by CYP2D6. So very, very important to look that up or run a drug interaction screen to see if paroxetine is going to affect the drugs that your patient is on. Now, on the flip side, paroxetine being a CYP2D6 inhibitor, some drugs are prodrugs and are activated by CYP2D6. So if we stop the action of that enzyme, we're potentially going to blunt the effects or stop the effects of a couple drugs. And there's a couple of classic examples. So Tamoxifen needs to be activated by CYP2D6, or primarily needs to be activated by CYP2D6. So in management of breast cancer, that's obviously not a good thing to potentially reduce the effectiveness of tamoxifen there. And codeine is also the other classic example, which I believe I have covered before on the podcast. But by inhibiting CYP2D6, you prevent the active metabolite of codeine and ultimately could reduce the effects and or put somebody into maybe some withdrawal symptoms as well if they've been on codeine chronically, which hopefully they haven't, but if they have, there is that potential. And then a couple other drug interactions, which I've definitely covered on previous SSRIs. So that bleed risk, keeping an eye on that, particularly patients on multiple, maybe an antiplatelet medication and an anticoagulant, or people at high risk for bleed for whatever the reason there. Keep an eye on that. Paroxetine has been reported as potentially exacerbating that, or all SSRIs, I guess. And then, of course, any serotonergic drugs as well are important to think about. MAOIs, TCAs, SNRIs, we're likely not going to use paroxetine in combination with any of those. But if it flies under the radar or gets missed, the increased risk for serotonin syndrome certainly exists in those situations. All right, well, I hope you enjoyed the podcast today. Go to reallifepharmacology.com, snag your free 31-page PDF on the top 200. Great little study guide or review on the top 200 drugs, and really, really important clinical pearls that are associated with those drugs. So simply for signing up, getting updates when we've got a new podcast episode, you can definitely gain access to that. Absolutely no cost to you, other than just simply getting it through email there. If you like the show, leave a rating, review on iTunes or wherever you're listening. That's greatly appreciated. And certainly supporting our sponsor, meded101.com/store, helps us keep this podcast going and educational for all to enjoy. You can track me down on LinkedIn or at mededucation101@gmail.com. If you have any questions, concerns, comments, or I goofed up on anything, definitely don't hesitate to reach out to me there. I'm going to sign off for today. Thank you so much for listening. I hope you enjoyed this. Share it with a friend if you did. And appreciate all the listeners out there for the comments and kind words. So signing off. Take care. Have a good rest of your day.
Lucky Land Casino, asking people, what's the weirdest place you've gotten lucky?
Lucky? In line at the deli, I guess?
Aha, in my dentist's office. More than once, actually.
Do I have to say?
Yes, you do.
In the car before my kids' PTA meeting.
Really?
Yes.
Excuse me, what's the weirdest place you've gotten lucky?
I never win and tell.
Well, there you have it. You can get lucky anywhere, playing at LuckyLandSlots.com. Play for free right now. Are you feeling lucky? No purchase necessary. Void where prohibited by law. 18+. Terms and conditions apply. See website for details.